Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Most of us choose where to live based on things like schools, housing prices, or how long it takes us to get to work. Today, Stephanie Desmon talks to Johns Hopkins researcher Shima Hamidi about new research that suggests the way our communities are built may have a bigger impact on our health than we realize. Let's listen. Shima Hamidi, thanks so much for joining me.
Thanks for having me.
So let's start with the basics. When you talk about urban sprawl, what do you mean?
Well, urban sprawl is a type of neighborhood development. Like if you go to a typical suburban neighborhood, you will see that it's very low density, mostly single family housing, large lots, very large street blocks, low level of street connectivity, not many intersections, and not any other use. No commercial, no coffee shop, no, grocery store. It's nothing but single family detached. This type of development, which is very dominant in the US, most of us are living in such neighborhood, is called urban sprawl, this type of development, as opposed to more compact type of development, compact and connected, which is mixed use, mixed type of housing, close to everything else, other destinations, smaller blocks, more intersections, safer for pedestrian and cyclists, which creates an absolutely different environment around your housing unit.
So people often assume that moving further out is cheaper and that it gives you a better quality of life. But your research suggests the story is more complicated. What have we been getting wrong?
It's partially true. Housing is cheaper in more sprawling areas. Of course, the further you go from the city, land is cheaper. And so the price you pay per square footage is cheaper. But that's just a small piece of the story. Most often people forget two other major household expenditures that are part of the bigger picture. The first one is transportation. In sprawling areas, you don't have more affordable transportation options such as walking and biking. Public transit simply is not feasible in more sprawling areas, and therefore you have to drive everywhere you want to go. You have to have own multiple cars per household, and that exponentially increases transportation costs for households. The other important component is energy costs, the cost of energy, which has been increasing rapidly in recent years. And in sprawling areas, you have larger houses, less efficient, more exposed surface areas. And that means a significantly higher energy cost per household in more sprawling areas. When you add transportation and energy costs together, that actually offsets the lower cost of housing. So the combined cost of housing, transportation, and energy together is cheaper and more affordable in compact areas compared to more sprawling areas. That sometimes translates to a significant amount of money saving for households living in more compact and connected areas.
People don't think of that, though, do they?
I think the transportation and energy costs have been largely overlooked because when you pay for housing, it's a huge amount of money either goes to rent or mortgage. But for transportation are small pieces of money, depreciation, insurance, maintenance, registrations, all of those like small pieces. And yes, it's most often is not noticeable. But if you add them all together, you will see that it will end up a significant amount of money, and a burden similar to energy for households in sprawling areas.
So your recent study links community design with outcomes that don't seem obviously related, from heart disease and traffic fatalities to even Lyme disease. What's the common thread here?
The common thread is reliance on car and really not having any other option but to drive anywhere, everywhere. Long driving, fast driving, which means more dangerous, situations in terms of traffic safety. People in more sprawling areas are 2.2 times more likely to be killed in a car accident, 6.5 more times if you are a pedestrian. And living in more sprawling areas, more likely to be killed in a car accident. More driving means sedentary lifestyle, less walking and biking. So it means, more likelihood of obesity, substantially higher likelihood of obesity and other chronic diseases that come with it, like high blood pressure, heart attack, and diabetes. All of those are more likely to happen in more sprawling areas. Living in sprawling areas also means a more likelihood of living close to forest, in the border of forest and natural areas, which means more likelihood of interactions between human and tick, which is a cause of Lyme disease, a vector-borne disease, which again the incidence of Lyme disease has been increasing exponentially in recent years. Living in sprawling areas increases the incidence of Lyme disease by 62.5%.
Wow.
And that, again, is another health risk factors that comes with the place you choose to live.
But when people think about compact development, they think about density and traffic and higher housing prices. So how should we think about the trade-offs?
Density or compact doesn't necessarily mean like downtown Manhattan. I think that's what most people think of compact and connected. Even if you are living in a neighborhood that is mixed using, has a moderate density, mixed types of housing, you have different destinations nearby. You can walk to coffee shops and restaurants. You can walk to a transit stations and get connected to other parts of the region. You have a community center that you can again walk to. I want to give you an example. For example, in Arlington, Virginia, is a place that is not very dense. Is not like Manhattan type density. It's a moderate density, but it gives you all the advantages of, living in a compact and connected neighborhoods that we are talking about. So it can be suburban, but it can be more compact and connected. And that is an ideal type of neighborhood for living and for building, my recommendations to floor planners and urban designers.
So your research suggests that decisions about roads, housing, and transportation are also public health decisions. So are we asking public health experts to be part of the conversations enough?
I think as long as we keep health departments in cities separate from planning departments, there's going to be always this disconnection between neighborhood design and health outcomes. I think there should be conversations and collaborations and coordinations between health departments, transportation and planning departments in cities, all different levels of government, but especially in cities where they are in charge of zoning, land use decisions, neighborhood design, all these policies that affects our neighborhood form. The more coordination will make decisions and our neighborhood design healthier and more environmental friendly long term.
And are there mechanisms where public health experts are involved?
There are some mechanisms and some tools that have been designed to facilitate that, like health impact assessment is a public health tool that helps when planners and designers and construction managers to come up with an assessment of future health outcomes of that development before it's being built through scenario development. But how often and how popular they are, that's the question. Often they are being used, especially in medium-sized cities, not very large cities. Where very large cities, you will see them being used more often. But in other cities, like nationwide, not really. There is much coordination between public health and planning at the moment.
Mm-hmm. So if someone listening can't pick up and move tomorrow, what are some ways they can make the community they already live in healthier for themselves and their families?
Unfortunately, fixing urban sprawl is a long-term, very, very, very long-term effort. Is not something that can be done overnight, but there are ways to make it mitigated and change the neighborhood. The most important one is changing zoning policies and regulations. Single family detached zoning is the most important, facilitators of sprawl, where you tell developers you only have to build single family detached in this neighborhood and nothing else. You are not allowed to build anything else. Even if you want, we have to change this. We should let the market decide what is best for that neighborhood, what composition of land uses. And many cities have done that. It's called zoning reform. I would encourage other cities, like especially medium and large cities, to consider zoning reforms, consider mixed land use zoning types, consider letting more density to happen within existing suburban neighborhoods. And not only in terms of housing, but other uses. Mixed housing, but also mixed other uses that are daily destinations of people, breaking blocks, super blocks into smaller blocks, adding pedestrian safety features to the streets and making them more friendly and welcoming for pedestrian and cyclists to use, to walk and bike. All of this will, over time, will pay off, and we can change the neighborhood's composition. Several cities have done it, absolutely possible, and it makes a huge difference in people's health and well-being.
Sometimes I imagine that's a hard sell, though. So how do you convince people that this is a better way?
Looking at the numbers, looking at what the data says, just looking at the rate of obesity that you see in the US versus other developed countries, the rate of car crashes and fatalities that you see in the US versus other countries, 12 times higher fatal crash rates in the US versus more European, countries. The same for obesity, the same for, I can share with you a long list of health outcomes that comes with, just this type of development. That again go back to zoning regulations that are 100-year-old, 150-year-old, never have been updated. And I think many policymakers have recognized the need for change. Some of them have done that. If we want to change this scenario, this health, we have to think about these health outcomes before it's too late, before people get into the place where they need to visit a doctor. It needs to be fixed before that. And it saves us a huge amount of money upfront later on for healthcare. So again, overwhelming evidence for years, and our study adding to that suggests that more compact and connected neighborhoods will make a big difference in our health, well-being, in our budget, social connection, social interaction, mental health, physical health, and our overall quality of life.
What about people who just say they want to live out in the country?
Absolutely fine. Our point is about giving everyone an option. They should have an option to live the lifestyle they like, they prefer. But people who want to have an active lifestyle, they want to live in more compact and connected neighborhood, also should have that option. And right now, there is not such a balance in the US. It's dominant suburban type of development, and the demand is much higher than what is supplied in terms of more connected and compact neighborhoods, which actually make them less affordable and more expensive because of this imbalance of demand and supply. But building more compact and connected neighborhoods and letting people who want to live in more sprawling areas having the choice to do so, I think will give everyone the option to have the lifestyle they want.
Shima Hamidi, thanks so much for joining me.
My pleasure.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.